There it is.
And we are now live.
Perfect. All right. Well, we're back. This is Senate Health and Welfare continuing on January 12th. And we have folks from DCF here with us. We have Miranda Gray. Welcome. And you'll introduce yourself for the record. And Emily Hazard will also do that. So we have our Deputy Commissioner. Why don't you start first?
Thank you so much. Yes, for the record, my name is Miranda Gray. I'm the Deputy Commissioner for the Child Development Division. And Emily Hazard, I'm the Child Care Benefits Administrator for the Child Care Financial Assistance Program.
Good, excellent. And so, Katie, are you going to give us a background on the bill on child care? What are we doing?
When we're at 11 o'clock, we'll touch on Act 45 as
We'll do that.
the old bills. Yeah. the monthly.
And all to say that as we catch up on the work that we have done with regard to childcare, and then knowing that we're getting a very important report this next week on the 17th from the RAND Corporation on on the finances for childcare. So I thought it might be a good idea before we start reading a report that we understand the baseline for childcare investment and oversight. So that's the goal today, and I'm very happy that you could be here at this time. Thank you. You go right ahead.
All right, thank you. We appreciate the opportunity to come in and talk about this. And certainly if there are additional questions, if I didn't quite get what you were hoping to learn today, then let me know and I'm happy to come back with further information or send that along.
Do you want to share screen?
I didn't bring that ability. I apologize.
Alex can put it up if you'd like that, because we have your information here. It's a PowerPoint, so we could put that up if you want us to have.
Is it on our website?
It is.
Yeah.
Yeah, I think if you have it, we did print out copies. And I'm sorry, this is the first time I've testified in person for the Senate.
Oh
So
my gosh, we've been on Zoom.
Yes, and so
I forgot all about that.
I was told there were certain rules that only bring paper, and so now I'm like, oh, we could have
Those
bought.
are changed.
Okay.
We've
I was a
modernized.
bit naive.
We're in the 21st century now.
That is why I have my paper in my life.
Yes. We're gonna put it up behind you.
Okay,
Yeah,
perfect.
you won't see it,
Thank
but we will, and that helps. That's good. Terrific. I forgot. We've all been remote. Isn't it nice to be?
It is very nice, and now, but thank you for your kindness in my learning about what the in-person.
We're all
rules
learning.
are.
Okay.
You have the best technology. Okay. So we are from the Child Development Division and going to talk to you about the Child Care Financial Assistance Program today. I'm sorry, is it all right if I just say, please advance?
Oh.
Next slide, please. So we are going to share about what the rate structure is, as well as what the eligibility criteria are for the Child Care Financial Assistance Program. I believe the request is also to talk about the landscape of the child care payments, including workforce, and then also child care resource distribution. So that is what we're hoping to go over. Next slide, please. So what is the Child Care Financial Assistance Program? It's administered by us, and it's our mission. It's a part of our mission to improve the well-being of Vermont's children. The program provides some or all of the costs for early care, early education, and school-age care for eligible families. This helps to ensure that all children ages 6 weeks up to the age of 13, and for those for special circumstances for children up to the age of 19 years old, have access to quality care. Is that CDD contracts with 11 community child care support agencies. These specialists help families find child care, and they also determine eligibility for the families.
So we have time. Is it okay if folks interrupt you with their questions?
Absolutely.
Okay, good. And so we'll do that.
The program assists many different types of families, whether caregivers are students looking for work, are retired, or working. And just as to give you kind of a baseline, a family of 3 with a household income of $80,000 a year qualifies for some assistance. Our current budget is $62.75 million, which is a combination of both general fund and federal funds, and that is our Child Care Development Block Grant.
Okay, so maybe, are you gonna talk through each of these, like the block grant and the CCFAP and so we won't need to.
Yes, I'm hoping, but let me know. Yeah, all right, next slide, please. We thought we would dive a bit into the child care financial assistance.
Before you move on from the last slide, do you have any kind of data on the number of children involved in the program or the percentage of the month? Is that later on?
It is later on.
You know, I just realized that a big faux pas on my part, that we should have committee members introduce themselves to you because we have a newly constituted committee. So I'm gonna stop here and
Senator Dave Weeks from Rutland, Lieutenant Proctor.
I'm Martine Rupp-Hewitt from Burlington. I represent Chittenden Central.
You too. I'm Ruth Hardy from the Addison District.
Terry Williams from Rutland District.
Jenny Lyons, Chittenden Southeast. So,
Thank you.
welcome.
I did that first presentation.
No, it's online and we have it here and then Alex put it up there.
Awesome, thank you.
So I thought it would be important to start to let you know that our child care financial assistance changed really recently. So this summer, we implemented the minimum viable product of our new IT system of Module 1. So we launched that in July 3rd, and that changed what families experience with the CCFAP program was. It used to be that there was a co-payment for every child in your family. And now what we have done with the launch of our new system is that we look at a family's income eligibility, and then we determine what their family share is based upon the age of their youngest child. So that is what we're going to talk about today because that is the most relevant information about what our system looks like. So what we had launched for the rates, they were based upon using the 2019 market rate survey and set at the 75th percentile. The 75th percentile was important for us because that helped us put us in compliance with federal requirements. We have set a cap on what our rates are. This isn't new. We've always had a cap. However, they were increased last year. Of importance here as well is that the state pays the capped rate or the provider's rate, whichever is less after subtracting what the family would owe. And so this is a little bit of a change from what it used to be. If a family uses more than one child care provider, the family share is paid to the provider that cares for the youngest child first. This is fairly common. And then the portion the state will pay for an eligible family will depend on the family's application, the provider's rate agreement, the state's capped rates, and the amount the family is obligated to pay, which is the family share. So it is a number of components put together, and we're happy to go in more depth if you would like, but we just thought kind of giving you a level set of what goes into the CCFAP rate. Next slide, please. This next slide is what our rates are presently. So you can see we have a tiered rating system. It goes from 1 to 5 stars, and it also has our licensed childcare homes as well as our registered homes. And those rates are vary depending on the child's age, from infant to school age, and then also the stars. The state pays more on behalf of the family with the more stars that a program has. So this is to just give you a sense of what families might be being charged, but these are what the state will pay for a slot, generally speaking.
What's the relevance of stars?
That's what I was gonna just ask you.
Yeah, so this
Take
is
a deep breath.
so this is the quality of a program. So what programming, what educational levels have the staff achieved? And there are ways for programs to earn more stars in which we help support them. And the stars is really to help families understand, to have a gauge of what level the program is that they would be potentially having their child in.
So is it the variety of programs available or the quality of the program?
The quality of programs.
And it's both for home-based care and non-licensed care centers. Can you just give a thumbnail of the difference between those two?
Yes, so the licensed are typically center-based, however, they can be family child care homes as well. And then we have, just have to meet a little more criteria, which I don't know if Emily has off the top of her head, but if not, I would be happy to follow up after. And then we have our family child care home providers who typically, they care for less children in their homes. And I want to go with the 6 children, and there's a bit more for school-age children that will be joining at the end of the day or over vacation.
And that's restricted to 10 hours a week for the school-age kids.
I think you're thinking of universal pre-kindergarten
Yeah,
is the 10 hours.
never mind.
Yes, there are so many nuances.
I know.
Okay. All right. So I'll go to the next slide. Sorry, I realized that the person who's doing that needed to step out.
He's getting you some water.
I think I do have a water bottle.
Or use it. Very good.
Okay, sorry, that was another rule.
So are we stuck here for a second? I could ask.
Yeah, go ahead, ask
Okay,
another
so
question.
school-age children. I need to understand the concept. Is this like after, before school, after school? You know, but school-age kids.
Yes, so I would, generally speaking, it would be like after school, but there are some families that need help with before school care as well.
Some families are only accessing care during school vacations or summers or school closure days. So yeah, it's a combination of schedules.
After school programs fall into that category.
Yes.
Go ahead.
Go ahead. Okay.
Well, good, okay.
Okay, so the next slide is talking a bit about how families or caretakers are found eligible for the Child Care Financial Assistance Program. So to be eligible, a family has to have a reason for childcare. We call this like the service need. So it must have a job. Thank you very much. They're self-employed, looking for work, attending school or training, participating in reach up, or has a special health need with a significant health or specialized development needs, or has an open family services case, or the family is experiencing significant stress. And significant stress could be like the lack of shelter, substance use within the family. The family must also meet income guidelines, must be a Vermont resident, and the child receiving care must be a legal resident of the United States. So those are those main components. Go to the next slide, please. The next slide gives you a sense of what those income guidelines are for families. So within the chart in the gray section is the gross monthly income. So if you have a family size of 3 or less, and they have a monthly income of $2,800, their weekly family share is $0. And I just want to point out the weekly family share is that it's weekly. So we talk about monthly, but what a family's obligation to pay for childcare would actually be multiplied by 4.33. To just give you a sense. Yeah.
Is the weekly family share per child or per family?
Per family. So that was the change that we made this summer. Next slide, please. I think next we'll just talk a little bit about the child care landscape. So how many children are we serving, how many families, etc. And then how many programs that we have. So if you wouldn't mind going to the next slide, please. So this slide is the number of child care programs that we've had over the last 6 years. I thought this would be helpful to just get a sense of how is Vermont fared during the pandemic. I think because we all hear a lot of programs have closed. I would attribute us being able to not have a huge loss to the fact that we have received a significant amount of American Rescue Plan Act funds. And we have done a lot of capacity building, so trying to increase slots at current providers, as well as helping new programs that would like to come online. So for September of 2022, we had 394 registered family childcare homes, 24 licensed family childcare homes, center-based programs, the non-reoccurring, that would be, for example, at a ski lodge. assistance.
Okay,
So just a family that would like to have some care while they think about skiing. The center-based program, we have 495 of those, and then after-school programs, we have 150 programs.
Just out of curiosity, this is the number of programs. Does it also reflect the trend in the number of children able to be accommodated? Because maybe some programs, they're larger in size, they can accommodate more children, but there are fewer programs. So this is the number of programs. Is the same trend reflected in the number of children capable of being provided for by the programs?
Yes.
Meaning that the programs could be declined, but the number of seats could be increased or flat.
They could potentially, you're right, if we were opening a large center, I would say that large centers work in our more populated areas and they do not in our more rural areas, just because there's just not the number of children.
So this same trend is seen in the number of children for full service by programs. So we're sure.
Yeah, of course.
so is there, as we've gone through the pandemic, we've seen that decline in the old top bar. Have you evaluated why that's happened? Or what are the reasons for maybe some of the closures that we're seeing?
So we haven't done a strong analysis, but
Yeah.
programs do let us know, and some have to close classrooms or their entire program because of staffing. Others have decided after the pandemic that they were no longer going to do this profession, like the family child care homes, etc.
Besides staffing, what are some of the other reasons for programs closing? It's kind of critical to understand that concept.
Yeah. Some notes.
Is it licensing? I mean, it could be 100 different reasons, but we don't want to guess.
Right.
If there's any data, feedback.
I would love the opportunity to give you that data because I know that we had pulled some of that, and so I think that would be the most beneficial for you to see what we have gathered rather than me ad-libbing. If that's our.
Yeah, I mean, you can imagine it was burnout, or you can imagine it's just workforce, or you can imagine it was a decline in kids. You can imagine all of it, but it would be great to
No.
have your the data that you've got to be helpful. Thank you.
So the next slide, please. This is the, as of September also, 2022, the number of children that we are serving presently. Actually, I take that back. I'm like, no, that is wrong. Sorry, this is a slide, but it's not that. This is the number of programs that we have, and then this is the capacity. So this gets to like how many children could we be serving? And this is what I will say is reported capacity. So we have licensed capacity. This is what we've said a program, licensed capacity is what we say a program can care for the number of children. Reported capacity is what programs tell us they are going to serve. So the reported capacity broken down by the different age groups is the 28,000.
Do you have a comparable slide on demand?
Yeah.
Oh, good. I was gonna ask that.
Or I should say, I have the how many children that we have, and then there is also, I'm happy to follow up. We have not done that analysis, but Let's Grow Kids puts out a report each year, or I think it's every 2 years, that will show you what they consider to be the anticipated need.
Okay.
And so I can send that as well. So the next slide, please, is actually, it has on it, I thought it might be helpful to see where families were falling within the income guidelines. So who we're serving, and then the total number of children that we are presently serving is 6,740, and that's a total of just under 6,000 families.
I'm not sure I understand. So you're serving roughly 7,000. Capability is 28,000.
Correct. And I would say that's at a given time. I think one of the things that we do know is it depends on staffing. You can only have, there's ratios, staff to children. If you don't have the staff, then you can't have the children.
But that doesn't show how many kids are out there in, on a waiting list or in need of, families in need of childcare services.
Correct. That would be,
And you can get us that.
yes, I can share with you the list of kids who have.
Just to clarify for Senator Weeks, the slide that shows the capacity is showing the number of slots that are available to all children. And then this slide is the number of kids served by CCVAP that are getting the subsidy from the
Okay.
state. So there are families that aren't eligible or don't apply for, and they're still, their kids may still be in childcare, but they're not getting the subsidy.
Thank you.
Senator
Yeah.
Hardy. That's a very, yes, I should have started that. We serve about 20% of the population that is accessing childcare with CCPAC.
20%.
All right, and then the next slide, please, which is our final slide. I wasn't exactly sure what resources you were hoping to, or incentives that you were hoping to understand, but I put the most recent programs that we had run. So that is the Coronavirus Resettlement Supplemental Act, I believe. I don't know if I quite got that right, but that is a program that we ran. It ended in April of last year, and that was $12 million that went out directly to childcare programs. We have the ARPA American Rescue Plan Act Childcare Stabilization, that's $29 million, and we send the last payment out to childcare programs next month. Then we also have our American Rescue Plan Act discretionary funds. These are funds that are more focused on, we are doing capacity building with those funds. We've also are bringing business technical assistance to childcare programs with those funds. We are putting in quality coaches with those funds. And then we also have what are called special accommodation grants, which I equate to being similar to what you would have like paying for one-on-ones in public school. That's what SAG grants are kind of the equivalent in early childhood. That's some of what is in the $18 million. So it is a bit different than the stabilization funds. And then most recently, we've been putting out the child care workforce retention bonuses, and that's a $7 million that was passed last year.
Just to make sure I understand, this is all one-time money that will be going away.
Correct.
So then, without this support, this was obviously a result of the pandemic and trying to keep these centers alive when there were no kids and probably maybe no teachers. So now what? Are they stabilized? You can't talk about the budget yet, but maybe we'll see something in the budget. I don't know. How are we going to keep these centers alive? And then because they'll be looking for the money that is paid for kids to support them. If that were possible, things would be great. Right now there's a deficit.
We did increase what we pay childcare programs on behalf of a family. So we had increased that coping. That was one of the previous slides of like, this is how much we pay for an infant. I think it was like $394 if you're in a 5-star program. But once again, that is only 20% of the population. The 80% would be the private pay families, and what it's their tuition costs increase. I think I would say anecdotally, I've heard from programs, they're concerned about not having this funding because this is just a small subset of the funding that they received over the last 2+ years throughout the pandemic. There was a lot of, Vermont was very generous, and we received a lot of funds federally as well that we were able to distribute to childcare programs.
I'm wondering if it would be helpful for you to talk briefly about the overall administration of this, because it touches on different programs, Reach Up, etc., and then CCFAP determination. How do you determine across the state, all these families, and how do you then end up with an appropriation or a CCFAP for an individual family? How does that all come together? I'm looking at, you've got the eligibility requirements. Is there a deeper dive on those? Do you look at the educational experience of the parents? How do you look at children with special needs, particularly in the infant group? So can you talk a little bit about the overall administration and how that's managed within CDD and elsewhere?
Yeah, I can.
That'd be great.
As we mentioned, we subcontract with 11 agencies. We're in 12 regions to administer CCFAP. So a family would submit an application that indicates their household members, their household size, their household income, their service need or reason for needing care. It's a single parent household. We don't look at the parent in the household, their service need and income. It's a two-parent household. We look at both parents' incomes and reason for needing care. So the eligibility specialists, they get the application, they look it over, and then they submit or they send out a request to the family for further information. So pay stubs or documentation of what they're doing for schooling, documentation of a special health need, whether it's a parent or the child.
Does that come from a physician?
Yes,
Yeah.
yes, special health needs documentation. That's one of the options. There are other options. You can get verification from a special educator, somebody who's familiar with the parent or the child's special health needs and their need for accessing care. It's beyond just having a special health need, it's needing child care to help with developmental resources for the child or for the parent because they're not able to care for the child during that time, during the day. So once the eligibility specialist sends out the request for additional documentation, once they receive it back, they can finish processing the application. And that's when they determine how many hours the family is eligible for, whether it's part-time, full-time, or extended care. You just group eligibility into those three main timeframes. And then what family share they would have, if any. So looking at their household income, their gross household income, and figuring out what their family share would be. And then from there, the specialist creates certificates to the individual programs that says, this is how much we're going to pay you for this child. So the programs get the information that how much they'll be receiving for payments. And then the families also receive a summary of how much assistance is being paid.
So the money actually goes from you to the child care facility. It doesn't go to the parent.
Correct. We pay child care providers on behalf of eligible children on a bi-weekly basis.
So the determination is made once.
Annually, yeah, every 12 months, unless there are some situations where we need to review more within those 12 months. But generally, it is a 12-month determination of eligibility. If a family's income decreases during that time, we'll change their eligibility so that they're eligible for more assistance. If their income raises, as long as they're within our income guidelines, they'll actually stay at their original eligibility determination. That really helps some families just with less of a benefits cliff, more of a benefit slope, just gradually changing what they're eligible for at their next redetermination.
Then at what point has the parent applied to the child care facility center and then at what point is that determination made? How's that all come together?
Yeah, I think for the most part, families probably have a child care provider identified before they apply for child care financial assistance, but there are some times where they may apply just to see what their family share would be before they commit to enrolling in a child care program. Yeah, it really depends, but I think for the most part, families have identified who their child care provider will be.
If they can find one.
If they can find one.
Yeah, okay. This is good. Any questions there related to that? It isn't uncomplicated, but you have a system, and so now you've got your places across the state. But district offices, is that called?
Yep, they're the community childcare support agencies, and they're in the 12 AHS regions. We also work closely with Reach Up in every district. If the family is working with a Reach Up case manager, they can authorize childcare for the family, so the family can bypass the whole application process. We also work with family services in every region. They have a open case for the family that they can authorize childcare as a support to the family and for their safety planning. It's a lot of partnerships and
Yeah,
connecting with other various
you work that
resources.
out. And then can you talk a little bit about the IT that you utilize for data collection and then determination?
Yeah, so that's our new IT system that launched this summer, CDMN.
Yeah.
So that's where the specialists, they enter, all of the applications are entered into the system. Income is entered. That's also providers access the system to submit their biweekly billing and to access documents that relate to families' eligibility. So it has a parent interface and a provider interface and eligibility specialist. That's where they do all of the eligibility determination.
So has that facilitated the process? Has it gotten simpler to do the administration because of the new IT, you think, or not enough experience, or?
Yeah, we're still learning. It's a little bit of a change from what we were using before, and some of the processes are very similar and some of them are a little bit different with the IT component, but I think over time it will probably be about the same once we've
Sure.
passed that learning curve.
Go ahead, Senator.
Thank you. Is the Sarah Holbrook Center an example of a provider that would be under the CCFAP? Or a partner with CCFAP?
They sound very,
I was gonna say, I
Familiar?
believe they are one of our
Okay.
their programs.
This is one of the Burlington.
Which one were you? I didn't hear it.
Sarah Holbrook.
Yeah, I think so. That,
Yeah.
yeah,
Okay. Thank you.
and Robin's Nest.
Right.
Go ahead.
Are the regions listed somewhere so we can see what's available in our county? Reach up,
The district offices? Yes, absolutely. And then we could share also where our community childcare support agencies, because they aren't state agencies, they are contracted staff. And so we could share who those are as well.
in Rutland, it's the Vermont Achievement Center.
okay.
Yeah, that would be very helpful.
Yeah.
And yeah, and then, and any data on numbers of kids. You've heard the questions about where are the openings and where are the kids, what's the need, what's the demand? So that if you have that information, that would be extremely helpful to us. And then any data that you have on workforce. And we'll be circling back on workforce at some point to understand what we did, what the effect of our legislation last year has been. But anything you have would be very helpful. Good. Questions committee, we're a little bit early. This is really good. This is good. So on the CCFAP, we went to the 2019 market, 75% of the 2019 market when we passed the bill. When was it last session?
The year before last.
Year before last, yeah. So can you just talk about what that means, where it was before we went to the 2019 level? Because it was a significant increase. And can you just talk about the importance of that a little bit, what it was?
Yeah. Happy to do so. And I don't have the rates off the top of
Yeah,
my head, but it was increasing what we would pay to providers on behalf of families. And also really providing the support for families to being able to pay more of their childcare expense. And that is a part of also using the 2019 market rate survey is still kind of looking back at what are the costs going into childcare programs, but it did raise us up. I think prior to that, we were using the 2017 market rate survey. In the market rate survey, we have another one that is due. I believe we are doing it this summer. So then we will be able to look at what the expenses are for childcare programs. And then that's how we look at our rates. Does that give you?
Yeah, it does. So is it a cost-based system? It's not a cost-based system. What would be the difference with a cost-based system?
Probably significantly more expensive.
Yeah. I thought.
Yeah, so it, and I think that is something that I'm trying to remember if the RAND study was tasked
I think so.
with looking at.
I think they were, well, Katie will update us on that. but-
Okay, yeah, that was one of the components. They had multiple components of what they
Yes.
were supposed to look at for financing.
Yeah.
But that is one of the aspects of this, is not necessarily saying that this is the true cost of care.
Yeah.
Just a general question. I've seen lawn signs. I'm a child care voter. Governor's initiative for child care. And we're talking about child care here. How do these programs interface? Everybody has a different idea of what child care is.
That's a big one.
Do they interface? What you do and what they're talking about legislative?
What I can say, and I'm like thinking of the sign that you're probably, I've seen them too. We do work with, so the same advocacy partners are also a lot of times partners that are helping us with, so I will name like Let's Grow Kids has the beautiful signs that they put out. And they're also one of our partners that help us with capacity building. So they're instrumental in us being able to add more slots, is what we call them, around Vermont. But they also have a mission to be able to advocate for what they think childcare should look like in Vermont.
You just sort of tag on to what Senator Williams was saying. My lived experience with childcare is 25 years old, plus or minus. So it's not super relevant at this point, but I don't know if you're comfortable answering this question, but our childcare system has certainly been designated as in crisis, and this crisis is a word that we hear a lot. Would you agree that that is a correct term for the situation that we're in right now?
I think that it is, we are certainly in a challenging time, and it is the mixture of childcare expenses for Vermonters. It is a large expense for your monthly budget. And then childcare workers are some of the lowest paid staff in Vermont. So that is a challenge. There's a large disconnect there, and one has to be very thoughtful about how you approach that. I think what we found when we raised our rates, and mind you, we only support 20% of the population who's accessing childcare. A number of programs raise their rates because that is, we pay our rate or their rate, whatever is lower. So, but you also have to charge everyone the same amount. So there are challenges for those families that aren't eligible for childcare financial assistance, is that if the rates have raised, they just now have a larger out-of-pocket expense, and that is something that the RAND study was asked to look at. A part of Act 45 is that no Vermont family pays more than 10% of their income on childcare.
And is that also an issue because the cost of living is so different depending on where you live in the state? I mean, does that come into play as well?
Sorry, can we start with that?
Just cost of living is not flat across the state, so I was just wondering if that's also plays into this complexity, because it sounds like you're dealing with a flat rate across the board.
Yes,
Yeah.
absolutely.
And that's why the March rate, raising, putting it up to the 2019 market rate was so important, right? Because it was, I forget where was it at 2008 or 28?
I think it was 2017, market rate survey before then.
Well, and now we've got inflation that is hitting everyone, so the estimated cost would be higher regardless. Everything goes up. Go ahead.
Just a specific question about the the $7 million payments to provide the retention bonuses. You mentioned that the final payments are gonna go out next month. Is that what you said? That's what I heard you say.
Sorry, there was two items there. So the $29 million, the stabilization grants, that final payment goes out next month.
Okay,
The retention bonuses we have left open. So we had an initial surge of requests. I know that I continued to sign agreements and it was really, what worked best for programs or what was their capacity to request the retention bonuses. But we have left them open because if they hired new staff and would like to be able to give them a retention bonus, they absolutely can do that. So that won't end until it is time to probably May, because we would need to be able to get out the final payments before the end of this state fiscal year.
so do you know how much what percentage-ish?
Of the 7 million, I don't, but I can also add that to how much.
So I do know there are programs that are sort of struggling because it's a little complicated to do, as we've discussed in the past, so,
It is, yes,
yeah.
quite complicated.
What's complicated the application process?
Well, what we're specifically talking about is we appropriated $7 million last year to provide retention bonuses to childcare workers. And the way that the state had to distribute those bonuses is complicated for these really small childcare programs that might not have a lot of administrative capacity or expertise. And so there's this money that's available, but they might not be able to access it because they don't have the capacity to do so.
And that is exactly what we want to get. We want to have folks come in and report on workforce generally, but this is one of the areas that we're going to look at. I've received some emails about this, so it's always fun. Yeah, what we can do, what we can't do, and how they fit together. Any other questions? Go ahead.
I reached out during my campaign to a lot of people that do childcare in my communities. And a lot of them that used to do childcare said they got out of it because there were too many regulations and stipulations they had to comply with. So what that did was it took in these communities, it took those people that used to do it, now can't do it, onto the ones that are doing it according to regulation. Do you think that there are too many regulations? I mean, it used to be families used to do childcare. I took my kids to my mother because she was retired, and then it went from mom because she couldn't do it anymore to Patty down the road, and took 2 or 3 kids in and provide them exercise and a little education and that, and she doesn't do it anymore. So that's one of the biggest hurdles I've heard from my constituents, is that we want more people to come in to work here, but they can't find childcare at a reasonable level. So how do we fix that? Any ideas?
I do think it's a fine balance of, we have federal regulations that we need to do, and we are tasked with making sure that children are safe and that they are being cared for and educated. We opened all of our regulations and did work groups, to hear from the providers and by each provider type, because there are differences between center-based and family child care homes and even after school programs, to see what is working for you and what really isn't. And then is it something that we can look at changing, or can we absolutely not? But they are very lengthy regulations. I do believe we're in the process. One of our attorneys is now looking through proposed revisions. So it's going to take a bit of time, but trying to be responsive where we can, and then also making sure that we draw those hard lines when there aren't any, there isn't room to negotiate. And then also factoring in that some of the regulations are tied to other, like the Division of Fire Safety,
Right.
the Agency of Natural Resources, who is in control of drinkable water.
ADA.
Right.
Yeah, I mean, there's a number of factors, but we try to make sure that we hear voices and what can we do and what we can't do.
And if the state is providing resources and money, then then it becomes an obligation on the part of the center. Right, but so are the changes that your legal counsel is looking at, are those the rules or also statute? Or is it your licensing guidelines? Where is the look?
I think it's the rules.
It's in the rules.
Yes, that we're-
That'll be fun.
yeah. It has been thus far.
Well, I've got the disability rules right now, so that big. Okay, go ahead.
To correct me if I'm wrong, I think earlier we agreed that based on the slide showing the fairly radical decrease in the number of programs available in the state, that you would come back with some of those factors inhibiting the private sector from developing childcare programs or maintaining childcare programs. Is that correct? Sometime in the future, you'll come back to us with those factors.
Yeah, so, and I had written down the workforce, but you're looking more of like what might be other.
Don't focus only on workforce. There may be 1,000 different factors. And I don't want to, certainly don't want to contain, put boundaries around what those factors might be, because frankly, I don't know what they are. Certainly staffing could well be one, but there could be many, many others.
Salaries.
Yeah.
It's critical. So my perspective is from a private business perspective is what's inhibiting private industry from changing that trend, that downward trend of programs available to an upward trend of programs available to solve this issue such that we have the child care programs necessary for the population of children, parents who need the program. That's the fundamental issue.
That actually brings to mind, you mentioned, business and businesses that really have pulled out from this. They've closed, a lot of them have closed them.
Right.
So what role, if any, are businesses playing in this is an excellent question. I know Economic Development Committee is going to be looking at that. But if you have any information that would help Saturday weeks, that'd be great.
Yeah, I will look. I don't know if we have formal information, but I do know on occasion there are programs that will reach out to me to share where their concerns they can't find a building that will meet all of the required codes, or the sewer isn't large enough. I mean, there's a number of factors that certainly are like we're aware of, but aren't necessarily under our governance. But I can see what we have for information to share.
We need more infrastructure dollars from the sewers. Okay, the second. Right. Okay. Any other, I think this is a very good beginning conversation. We're starting to get our feet on the ground with this, so it's very helpful. Appreciate your time.
Thank you so
Great.
much.
Thank you for having us.
And any, if you have additional information, you heard the questions, and there are questions we haven't asked that we should be asking, inform us, educate us. It's great.
Absolutely. Well, thank you.
Okay, good. Good to see you. Thank you. All right.
Thank you.
Street City, we're gonna take like a 5-minute break, and then we're gonna come back, and Katie's gonna talk with us about legislation that was passed recently. We can get up more up to speed. So let's take a break. We'll go off YouTube.